The blood pressure cuff must be placed exactly in the correct position on the arm so that the rubber tube is aligned with the center of the inner elbow directly over the brachial artery. And during the blood pressure measurement, the patient should not make any unnecessary movements or talk. So how do we measure blood pressure? We can measure blood pressure in two ways, invasively and non-invasively. Invasive means that we directly access the artery using a cannula or a catheter and then connect it to a device to observe the blood pressure waveform. The important feature of this method is that it is completely accurate, but because it is invasive, we usually perform it in the operating room, in the angiography department, and in intensive care units like CCU and ICU. And this is not the topic of our discussion. But in the non-invasive method or non-invasive blood pressure, it is measured from the surface of the body. In other words, during a physical exam, blood pressure is measured indirectly using devices that we call sphygmomanometers, or in other words, blood pressure monitors. These are the devices used for non-invasive blood pressure measurement. We call them sphygmomanometers or simply blood pressure monitors. The common devices we have include the Mercury Sphygmomanometer, the Aneroid Sphygmomanometer, and finally the digital blood pressure monitor. Now let's talk about the components of a blood pressure monitor. All blood pressure monitors have a cuff. What is a cuff? It's a fabric part that wraps around the patient's arm, and inside this cuff there's a pocket or a rubber reservoir that fills with air, which we call the bladder. Two tubes are connected to this bladder. One tube is connected to a manual pump, which we use to force air into the bladder, increasing the pressure inside the cuff. The second tube is connected to a mercury reservoir, which displays the pressure inside the cuff or the bladder. In this way, when we inflate the manual pump, it causes the mercury to move from the reservoir into the mercury column and rise up the column. The mercury column is graduated, and the number indicated on the mercury column is exactly the blood pressure value. The higher the blood pressure, the higher the number shown on the mercury column will rise. Now, a question arises here. Why do we use mercury in mercury sphygmomanometers? Why don't we use water instead? The reason is that mercury has a high density. In other words, it is high density. In other words, 1 millimeter of mercury is equivalent to 13.5 millimeters of water. That means right now, the mercury column in a mercury sphygmomanometer is about 30 centimeters. If we were to use water instead of mercury, we would actually need a 4-meter column to be able to measure the pressure. The second type of sphygmomanometer is the dial gauge type, which has a structure exactly similar to the mercury sphygmomanometer. Dial gauge sphygmomanometers are also called Aneroid sphygmomanometers. Why? Because no liquid is used in them, neither mercury nor any other liquid. And that's why they're called dial gauge or Aneroid sphygmomanometers. This type of sphygmomanometer also consists of a cuff, a bladder, and connecting tubes. But instead of a mercury column to display blood pressure, it has a gauge or dial, and it's easy to use. This cuff is actually the same as the cuff used in mercury and dial gauge sphygmomanometers, and this is the bladder inside the cuff, which, as you can see, is made of rubber. This is also found inside the cuffs of other types of sphygmomanometers, whether mercury, dial gauge, or digital. Another point is that in both types of devices, mercury and dial gauge, but to hear the Korotkoff sounds as the artery opens, we need to use a stethoscope. Digital sphygmomanometers are also exactly like mercury and dial gauge sphygmomanometers, but they have two differences. First, instead of a manual air pump, it has an electric and automatic air pump. So by simply pressing a button, the cuff inflates. Second, the blood pressure reading is displayed digitally on the screen. Another specific point is that with mercury and dial sphygmomanometers, to measure blood pressure and hear the Korotkoff sounds, we need a stethoscope. But in digital types, the mechanism is different, and blood pressure is measured based on arterial vibrations and oscillations. In this way, during the deflation of air from the cuff, or in other words, depletion, as soon as the artery opens, the blood flow causes the arterial wall to vibrate and oscillate. These vibrations are detected by special sensors in the digital device, and the blood pressure reading is displayed on the monitor. And since the arterial oscillations and vibrations are very subtle, in order for the device's sensor to detect them accurately, the blood pressure cuff must be placed precisely in the correct position on the arm. The rubber tube should be aligned with the center line of the inner elbow, exactly over the brachial artery, and during the measurement, the patient should not move excessively or talk, because the sensors might mistakenly interpret these movements as arterial oscillations, resulting in an inaccurate blood pressure reading. Now, let's answer a frequently asked question. Among the blood pressure monitors we mentioned, which one is better? Which one is more accurate? All three types of devices we discussed are accurate and reliable if used correctly and according to the proper guidelines. However, Mercury and Aneroid sphygmomanometers require auditory skills and the use of a stethoscope. They are suitable for healthcare professionals and doctors. Digital blood pressure monitors are easier to use and do not require a stethoscope. For this reason, they are suitable for ordinary people and for home use, provided that the correct procedures for measuring blood pressure with a digital device are followed. What are those procedures? We said that the place where the cuff and tube are attached should be exactly on the anterior surface of the arm or the brachial artery, so that any slight vibrations that occur after the reopening of the brachial artery following the deflation of the cuff can be detected. The sensors detect it precisely and completely and show us the exact pressure. Therefore, if it is placed a bit more medial, a bit more lateral, or not exactly on the midline, it might not be able to detect these oscillations and, in fact, the slight vibrations of the artery. And the next point is that for measuring the patient's blood pressure, the patient should not make any unnecessary movements. If they move, are physically active, or even talk, each of these can cause a series of vibrations in the body. These subtle and often involuntary movements within the human body may inadvertently cause the highly sensitive sensors of the digital blood pressure measuring device to mistakenly interpret them as genuine Korotkoff sounds, or alternatively as significant vibrations and oscillations occurring within the arterial walls, and as a direct consequence, the resulting measured blood pressure reading may not be very accurate or truly reflective of the actual physiological state. Therefore, these principles must be observed when measuring blood pressure with digital devices.